and resources for discharging the functions assigned to each level are clearly defined in the Constitution, and none of the levels is an agent of the other. It is now your job to legislate and oversight responsibility, building on the lessons learned from the last assembly as we work together to build the future that we envisage for generations to come. We are overwhelmingly a Kenya Kwanza majority with a clear Hustler Nation mandate. I'll be proposing legislation to this assembly to align our county priorities with our party manifesto to build our economy using the bottom-up model that we already started experimenting in my last administration. My transformation agenda that will guide legislation during this second term administration will be hinged on the good governance pillar, the social transformation pillar, and the economic pillar. The high calling obliges us to remember the promises we made to Mama Mboga, border riders, and other drivers of the economy. The clarion call of Mama Mboga movement has occasioned the election of most of us into this house, I included. This clarion call should remind us, while serving, a need to reflect and always remember that the Mama Mboga movement has dawned, and we should collectively endeavor to live up to the expectations, dreams, and aspirations of Wanjiku. As I championed the county to a Kavamwalimu bid, I noted the hope and expectations our people have of us. Similarly, our people's hopes and expectations reverberated across the nation as Mama Mboga demanded better governance and an economic model that would meet the ambitions of the ordinary mwananchi. It is the same tune that rallied the whole country to a bottom-up movement that saw His Excellency William Samoei Ruto and His Excellency Rigathi Gachagua, our son, ascend to the highest offices in our country. Wanjiku has immense expectations in the institution of representative democracy. Socrates, the great Greek philosopher, said that an unexamined life is not worth living. We must, of essence, relook at our policy priorities and see what we can do better for our people. As we speak, our county and indeed the whole country has been severely tested by drought. This makes me sad that in the 21st century, we are still talking of hunger and giving cash transfers to mitigate hunger. These are short-term measures that we must do to save lives, but they are an indictment on our long-term planning and priorities. Mr. Speaker, honorable members, human resource remains a key combining force in service delivery. As we enter the third phase of devolution, the county government of Nyeri has a total of 3,857 employees, which comprises 2,617 permanent and pensionable and 449 who are contractual. The county also has 791 early childhood development caregivers. We call them ECD teachers. The county also engages casual staff through various departments depending on the departmental requirements. Mr. Speaker, in the good governance pillar, we have offered training opportunities for 800 youth interns through the Governor's Internship Program and absorbed about 50 attaches in various county departments, and over 3,000 have benefited through industrial attachment. We have ensured that our employees are paid on time, formulated and legislated over 40 policies and laws, and we thank this assembly and the former assembly. We further established governance structures to provide quality, efficient, and effective services. In collaboration with the national government to remove the bottlenecks that plagued such interventions in the past. We have made sure that fertilizer is going to the farmers and not to the brokers. We commit to further double the fertilizer and organic manure intake to increase production per hectare and expand crop varieties to include all crops with a resultant increase in production and encourage drought-resistant crops in semi-arid areas. Specialized eye hospital in Teto constituency. We have procured biochemistry analyzers for 6 rural health facilities, 3 parts hematology analyzers for 5 rural health facilities, clinical chemistry analyzers for Karatina, Mukurweini, and Mount Kenya sub-county hospitals, dental units complete with oil-free compressors and accessories for Karatina, and Mount Kenya Hospital, installation of laundry machine, Mount Kenya Sub-County Hospital procurement and operationalization of the ECG and LEAP machines. We have supplied and installed bulk oxygen plant and piping at Karatina Sub-County Hospital, which is ongoing, and Mount Kenya Hospital procured and supplied health commodities to all the 130 health facilities with a fill rate of about 80%.